Good afternoon and welcome to South Australia's daily COVID-19 update. Well, of course, today is a big day for South Australia as we have our young ones, 5 to 11, being able to go and have their have their vaccine shot. So a big day for 5 to 11-year-olds, probably some nervous parents, some nervous kids as well as they begin their vaccination program. Those vaccines are flowing into South Australia and they're going into the arms of those people that need them. We've held a cabinet meeting today via Zoom, also our COVID Ready committee meeting, and I'll now provide an update from today's meeting. First of all, the very sad news that we've had 2 deaths in the 24 hours up until midnight last night, a male in his 90s and a female in her 80s. I don't have any further details with regards to that at the moment. What I can also tell you is that yesterday we had 4,024 positive cases in South Australia, so quite a reduction from the day before. So this is now really a stabilising of our numbers. In fact, we've got to go back 4 days to get to a day which was lower than what we had yesterday. So again, I think the restrictions that were put in place on the 26th of December are now clearly showing that we've been able to stop that massive escalation that other states around the country are currently experiencing. Yesterday we conducted 21,845 tests, so a big day in terms of testing, especially for a Sunday. And again, a massive thanks to all of our SA pathology and our private labs for the great work that they're doing. And I note that yesterday there was a very big reduction in lab processing time through SA pathology. It fell to a very low number, so hopefully that's giving people relief, getting the results much faster through SA pathology labs. In terms of hospitalisation in South Australia, we currently have 188 people in hospital, so again an increase on the previous day at 176. We have 21 people in ICU and 4 of those people now are on ventilators. So we are seeing an increase in hospitalisation. We're likely to see that. We're not at the peak yet, and so we are seeing those numbers tick up further within our hospital settings and also our ICU. Pleasingly though, still no children at the Women's and Children's Hospital that have been in ICU yet right throughout this Omicron outbreak. In terms of the vaccination rate yesterday, of course, Sunday's a low day for us. It's the low point of the entire week because we don't have many of our GPs working, and also a lower number through the pharmacies, but we still did do a very good number through the South Australian Health mass vaccination clinics, but well down from the previous few days. In fact, we were down at 8,812 in total, and of course today we're looking for a much larger number, hopefully getting up closer towards 20,000. We've already announced that we're putting 10,000 of our paediatric doses out to GPs and also to pharmacies in South Australia before the end of this month. They tell us that they've got excess capacity to be able to put those jabs into the arms. We're very pleased to be able to work with them. It is a real partnership. In South Australia, it's about 50-50, 50% through the SA Health mass vaccination clinics and clinics across metro and regional South Australia. And then, of course, we have the GPs and the pharmacies doing a 50% combined between them. So this is quite a different situation from many other states where the GPs and pharmacy are doing the vast bulk and the state is doing less. We have really ramped up our capacity in South Australia. I can also tell you that we have a slight reduction in the number of SA Health staff who are not at work. Yesterday we reported 679 and today 673. Obviously, we are still working out the plans for the resumption of Term 1. I think all states are grappling with the same issue. We have seen Queensland move. They're going to delay theirs for 2 weeks, which means a week after South Australia is due to go back, because we are due to go back at this stage on the 31st of January. Queensland will go through and return on the 7th of February. But at this stage, no other states have declared their hand on this one. There is work being done at the moment. It is on the National Cabinet agenda for Thursday, and we are still very much on track to announce our position by Friday. I can tell you though, this will be a disrupted start to the year. We're in the middle of a very dangerous global pandemic and so we need to be mindful of that. We're going to try to minimise the issues in our state, but there are going to be disruptions for day one, term one in South Australia. Operation Limit continues, where the SAPOL are doing their inspection of licensed premises and venues and premises right across South Australia. There were 78 inspections yesterday. Only 3 were not compliant. So a massive congratulations to all of our premises across South Australia who are doing the right thing in a combined effort to take on front and centre this Omicron crisis. So only 3 non-compliant, and they received education. I can also tell you that the second wave of the business and hardship payments start today, so people can go on to the Treasurer's website, download that information. So for those hospitality, tourism and fitness businesses which are still down more than 30% over the last 2 weeks from where they would have been a year or 2 years ago, they are eligible for that second payment now. And for other businesses that are down 50%, they also are eligible for a payment. So I just encourage people. We've already put millions and millions of dollars worth of support out. It's our 7th package of support in South Australia. I don't know any other state that is putting out the support packages at this point with this latest wave. We certainly want to support those sectors which are adversely affected in South Australia. And then finally, I can just let you know that all of the plans are now moving along very quickly for the changed position that we have with rapid antigen testing, replacing PCR testing for close contacts as of Thursday morning. This week we'll be giving further details over the next couple of days of where people can pick up those rapid antigen tests. We will need them to get in touch with us. They are free. There'll be one that is given for day 1 and one that is given for day 6, and then we will be requiring people to give us the information as to whether they are a positive or not. Back to where I started, 4,024, so a big reduction. Of those, 155 were people who had used their own rapid antigen test and already put that into our figure in South Australia. Just finally, we note that there are some very disrupted supply chains right across the country at the moment. We're not immune to it here in South Australia, but it's certainly not as acute as it has been in other states, where when we look at the national press, we can see some big food and grocery shortages right across the eastern states at the moment. So South Australia is fully signed up to the national protocol with regards to returning staff who are asymptomatic in a very controlled way, but we are signed up to that position. And that has been announced by the Prime Minister today. We want to do that because by signing up to this national protocol and putting these procedures in place, we can make sure that in South Australia we keep food on the table for South Australian families. So now I'm going to open it up to questions and let's see how we go. I think Stacey is the first.
Getting those paediatric doses, and they say this is due to a failure by the state and the federal government. One of them even said that you're throwing GPs under the bus by expecting them to do too much and then not supplying them with the vaccines that they need. When will they get those vaccines, and why haven't they gotten them as promised today?
So the question is from Stacey Lee from the ABC. Some GPs are saying that they haven't received their paediatric doses. As we know, the distribution of those paediatric doses is done by the Commonwealth. We know that from Lieutenant General John Fruin, who controls the distribution, the purchasing and the distribution, that we have over 2 million doses. We have followed up with them to ask whether there are any supply issues. Of course, the whole country starting on exactly the same day has meant that not everybody has got the doses when they ordered them, but they should have received the date that they will be receiving them on. I think there may be only a delay of 1 or 2 days from any of those planned distributions. Can I just say, people should probably, the journalists, if you go on mute between questions, there would be a little bit of less feedback here, sorry. Sorry, I don't know whether that answers the question for you, Stacey.
Can I also ask you about the supply chain? You mentioned that you're returning staff who are asymptomatic, and you mentioned this morning that you are part of a plan to fix some of these supply chain issues in the chicken and the meat industry. The abattoir in Narracourt has written to staff telling them to come to work even if they're positive
So we have a national agreement which is for the food production and the grocery sector, but a lot of what is in that we were already putting into place in South Australia for red meat, for chicken meat production. Also, we spoke a couple of days ago about the disability sector where we had both a worker or a carer and a client who are both COVID positive. So SA Health lean in, they do that assessment and they can give that exemption. That's what they've done down in Narracourt. We have SA Health working with the abattoir, working with PIRSA in South Australia to allow people to go back to work in a controlled and careful manner. It's important that we do this, but every single sector will have slightly different requirements. Some will require rapid antigen tests, some will require high levels of PPE, some of them will require changed arrangements within the workplace. For example, not all using the same toilets or not all using the same lunchroom facilities. So SA Health works with the company through these situations. We are seeing skill shortages right across South Australia at the moment. It's not as acute as it is interstate, but we want to stay ahead of the game, and that's one of the reasons why we are signed up to the national agreement, but already working with sectors which are affected. No staff isolating. I've been having things passed through, dropped off to me and passed through fences at the moment, so it is a little bit complicated, but we conducted cabinet remotely. This is our first for the year. The last one was on the 30th of December, and of course we've conducted the COVID response team, the COVID Ready Committee meeting this morning. We've been conducting most of these meetings remotely for quite some weeks now, certainly since the 26th of December. So I come out of isolation on Thursday night. I haven't been given the time yet, but I come out on Thursday evening.
Thank you.
Thanks, Stacey.
Hi, Premier. It's Andrea from 7. Just following on from Stacey's question, just in regard to the abattoir, are you talking about people who are close contacts going back to work, or have you even given the green light to people who are positive with COVID attending if they are asymptomatic?
Look, I don't have a full detail for you, Andrew, but I'm sure we can follow that up. My understanding is both COVID positive and close contacts are going to be able to go back to work in a controlled way. This is in line with public health protocols during these outbreaks. There are very significant issues in an abattoir in terms of the overall production if there is a lack of manpower or a workforce. There can be some very specific and unacceptable issues in terms of animal welfare. So we're just working through those with SA Health, PIRSA and the abattoir at the moment. Obviously it's in a very controlled way where people that are positive aren't going out into the general community, but it's a very cooperative community down there. There is a higher level of infection down in that area. You would have seen this reported in recent days with regards to outbreaks following on from New Year's Eve. So our thoughts are with people down in the southeast who are experiencing that higher than normal level of infection down there at the moment. But SA Health has a team down there on the ground at the moment, part of our rapid response, providing support to the abattoir and to the local community. So as I was saying before, we are completely signed up to this. We do have some nuances here because we have different definitions to close contacts than other states, but by and large, we are signed up to these. But as I said, a lot of the protocols that are in place from today's agreement are things that we've already been doing in South Australia. And yes, we will certainly be looking to take the protocols involved in this to other sectors as well when we see that they could potentially also be critical sectors under workforce shortages.
And in regard to the parents out there struggling to get a booking for their child today, or for those who had appointments that they did have booked cancelled, do you think it was wise today to not have any appointments for children at Wayville, one of our biggest vaccination clinics, when people are so desperate to have their child
Well, Wavell is turned over to a booster day every Monday going forward. We're just trying to push through those boosters. All of the advice that we receive from health is that boosters are absolutely number one, and we want to push through as many as possible. My understanding is that 5 to 11-year-olds will be able to get their vaccination if they're booked in at Wavell as of tomorrow. But we have over 30 sites in South Australia, 30 sites that people can book in to get their vaccination at, and of course hundreds and hundreds of GPs and pharmacies on top of that. So the good news is that the vaccine is now in South Australia. The jabs are going into their arms. I know there's a lot of people that are keen to get that jab for their child straight away, but we'll do this in an orderly way. We'll ramp up that run rate in South Australia. We'll open up more appointments. We've already opened up 10 or 12,000 in the last couple of days, and we'll continue to see those opportunities open up. We are looking for all and every opportunity to get those jabs in the arms of South Australians, whether they be 5 to 11-year-olds, whether they be boosters, or whether they be people that are coming forward for the very first time.
Thank you.
Premier Harvey here. Is it now a race to get 5 to 11-year-olds jabbed before the start of term 1? And have you fallen the first hurdle by not having enough supply here, particularly on the GP side of things?
Well, Harvey, I've already been through the issue with regards to the GPs. We don't control them through the state distribution, so the federal government does the procurement of the paediatric dose. They've done that since day one, and they're responsible for the distribution of all of the vaccines, whether they be the paediatric dose or the adult dose. The paediatric dose is a different dose. It's a lot milder. It's calibrated for the 5 to 11-year-olds. It's had TGA approval, a TARGI approval. There's an 8-week interval between shots for the 5 to 11-year-olds. That's the advice that we've received from TARGI. I know that people are very keen to get them into the arms of their loved ones, but there are going to be tens and tens of thousands of doses being made available almost as we speak. We have 144,000 5 to 11-year-olds in South Australia. We have plenty of doses already in Australia, and of course plenty more coming for when the second dose is due.
Some parents have spoken today that they turned up to Wavell having been told by SA Health last week to try for walk-ins if they couldn't find a booking, only to be turned away. Is that an issue that they've been given the wrong information by SA Health?
Look, I don't think SA Health would be telling people to have a walk-in for a paediatric dose, because it is quite a different dose from an adult dose. It requires a different level of training for the person administering it. Obviously, it's a different vaccination, and we're not offering it at Wavell on Mondays going forward. So this is not one that people can just turn up for. They need to book in, and that's why we're working overtime at the moment to try to open up as many opportunities for additional appointments for 5 to 11-year-olds for the next couple of months. Certainly, we've opened up another 10,000 appointments with GPs and pharmacies over this month, another 2,000 at Wavell every week going forward, and we're going to look for more opportunities to get more jabs in arms for our young ones in South Australia.
And how are we going, Lyle McEwen? I heard we're at Coastat White today. Is there some real critical pressure on that hospital at the moment?
Look, there is critical pressure on every single hospital around the country at the moment. We're in a global pandemic. Omicron is particularly worrying. I'm very pleased that in South Australia, that despite the fact that we have 188 COVID positive patients in our hospitals, it's still within our ability to cope with. So that's absolutely fantastic. And don't forget, we're also very well supported by our private hospitals in South Australia, and we already have arrangements in place for both Lyle McEwen, the Royal Adelaide Hospital and the Flinders Medical Centre for people to be moved out into the private sector. Not COVID patients, but that will just alleviate some of the pressures, and I think that Lyle McEwen has already put some of that into place.
Thank you. Good afternoon, Premier. It's Alan from 10. Just a reference to the numbers, you note there was a downturn today. Is that just an anomaly, and does it fit with the modelling that shows a peak later in the month, and is that modelling available yet?
So the question from Alan Murrell from Channel 10 is really about the downturn in numbers today, the modelling going forward, and whether today's downturn sits in with that modelling. Look, Alan, we are going to see a bit of a jumping around, but what we do know is that the doubling rate in South Australia is really at the higher end compared to most other places in the country. If we go back to the end of last year, we were doubling almost every second day. We're now doubling, our doubling rate is beyond a week, and in fact we've been sitting probably around that high threes up to mid fours for the best part of a week now. So that's very good news, and it seems to me that the additional restrictions that were put in place ahead of New Year's Eve were really good for South Australia, because we see many other states with a massive escalation of their numbers, and in South Australia we sort of see a far more flat line. So that's absolutely fantastic. We've got another meeting with the modellers tomorrow, and we hope to have something released before the end of the week which shows where we were heading, where we're now heading, and hopefully be able to put a finer point on when we're likely to hit that peak in South Australia. Certainly I've been messaging that that's likely to occur before the end of this month. We've got some other states that say that their peak is going to hit early next month. I think we're probably all going to get there around about the same time, but the advice that I'm receiving is that we will hit that peak by the end of this month. People have said this is going to be short and sharp. I think they're right. This is not going to be something that we're going to be lingering with for 6 months, 12 months. Omicron is going to go in and out. But it is really important that we slow it down so that we don't have all of those hospital presentations at exactly the same time. When we look at some of those numbers in New South Wales, Victoria, other places, they're very, very high at the moment. I think more than 2,000 people in hospitals up in over in New South Wales at the moment. I think that's the equivalent of about 10 Modbury hospitals filled with COVID patients. So the reality is that we are cautious here in South Australia, but I think we're starting to see some real green shoots, some real improvement in our position over 2 weeks ago.
With the return to work protocols that you're talking about with supply chains, are you anticipating that that might be extended, if it does work, to other industries, particularly hospitality and retail? Are they the sorts of areas that would be considered if it does work?
So obviously the protocols put in place by National Cabinet today deal with food production and grocery. These are acute problems, especially in the eastern states, but we will also look at extending these to other sectors. We've already done that here in South Australia once in the disability sector, and of course, as I previously said, with red meat and chicken meat production. And look, it's very likely that we're going to continue to see skill shortages, but it's a balancing act, because on the one hand, we want to get workforce back in place, but on the other hand, we want to slow down the rate. We don't want it to overwhelm our health system. So often these two things are working against each other, and that's why these protocols have been developed, so that in a safe way we can take people who might be infected, particularly those that are asymptomatic, and then in a controlled way allow them to go to work with plenty of protections in place. It doesn't mean if they're going back to work they can then go out into the general population. They'll still be required to quarantine between those shifts that they're working.
Well, thank you very much. I think that's covered the points I needed. Thank you.
Thanks, Alan.
I'll jump in. Daly here, to us. When you talked about the change protocols for the red meat and chicken meat industry, do you ever see that hospital work who are also facing workforce pressures?
Sorry, you're just cutting in and out there. Are you on speaker? Can you just go on to your...
Can you hear me better now?
Yes, thank you.
Yes, it's Steph from Indaly. Just when you talk about the change protocols for the red meat or the chicken meat disability sectors, do you ever see that also extending to hospital workers who are also facing workforce pressures?
So the question from Steph from Indaly is, do we think that these protocols, these return to work protocols for areas like red meat and white meat, chicken meat production could extend into hospitals? Look, the answer to that is yes. If we find ourselves in a situation where we have critical shortages, we will need to be mindful about, in particular, those people that are close contacts. I don't think we will be turning COVID positive people back to work in our hospital settings, but certainly some of the close contacts. But as I've reported in meetings so far, It's not really a requirement at the moment because those people that are either COVID positive or furloughed at the moment, most of them are fully deployed within the health system supporting our community response care team, the cricket team, which is really supporting the 98%, 99% of people who are living with COVID at home. So it's not like that workforce is completely lost to us. So I think we're a long way off that in South Australia, but of course we just need to see where this is going to go, this particular pandemic.
And of the 188 people who are in hospital, how many of those are vaccinated, and are you concerned about the vaccination rate of those that have been placed into hospital?
So it does take some time to do that full the question is, what's the vaccination rate of those people in hospital? It does take some time to reconcile that because when somebody comes in, you've got to look them up on the Australian Immunisation Register, which is not controlled by the state government. You need to look up their name. There might be, 400 Steph Richards. So you've got to basically go through and find out which one it is and what their vaccination status is. So we're trying to do that as quickly as possible. We have done that reconciliation on a very regular basis for those people in ICU, and it's pretty normally showing well above 50% of those people that are in ICU are not vaccinated. And so this is a massive, massive overrepresentation. And so we are still very strongly encouraging people to get vaccinated as the front line for protection for themselves and their families, their work colleagues and the entire state. So there is a massive overrepresentation. What we know about Omicron is it is highly transmissible, but the vaccination will slow down the transmission. So you're less likely to catch it, less likely to transmit it. But you do catch it when you've been fully vaccinated. That's why we've got to get those boosters into the arms to get that higher level of protection. But what we also know about those that are vaccinated is there are much, much, much lower symptom levels. So when we were back talking about Delta, when people weren't that vaccinated, we saw a hospitalisation rate of around 5%. In some of the earlier waves, when there was no vaccination rate in Australia, we saw hospitalisation rates around the world of around 10%. What we're seeing now is below 1% of people are ending up in hospital, particularly those people who have a level of protection through vaccination and a booster.
And on the issue of schools, are you considering delaying the start of the school year, particularly for students who are starting school for the first time, reception students who might be 4 years old and are ineligible for vaccinations?
Look, what we know is that students do much better face-to-face, and we've really got to look at two issues. On the one hand, we need to look at the health aspects, and the second, the mental health aspects of sending students back to school. We know that many students need to be in that supported environment. We can see already the implications in other parts of the world where they haven't had their students at school. We've been very fortunate. We've had the fewest days lost to face-to-face schooling of anywhere in the country, and probably pretty much anywhere in the world over the last 2 years. But we're looking at all of those issues at the moment. We're looking at whether or not we delay the start. We're looking at whether we go back in a bimodal way or whether we start back day one, term one, which of course in South Australia is the 31st of January. So we had Rick Purse, the Chief Executive of the Department for Education, and John Gardner, the Minister for Education in South Australia, in with the COVID Ready Committee meeting this morning. That was great. We'll continue to meet with them probably on a daily basis through to the National Cabinet meeting on Thursday and an announcement on Friday or before.
Thank you.
Thanks, Steph.
Hello, Premier. Andrew Huff from The Advertiser here. Can I ask you, please, about the food security issue that others have touched on? Do you have a message to anyone who may want to either engage or feel that they have to engage in any form of panic buying?
Look, I think what we've seen interstate is panic buying. I think South Australians are better than this. There are no food shortages. There are workforce issues interstate. We don't have them here in South Australia because we have been able to slow down the rate. Yes, there are going to be some shortages, but we just don't have nearly the problem that exists interstate. So I'm strongly encouraging people not to panic buy. There is no need for it. we're working through all of the issues, and I think the changes, the protocols that have been adopted by the National Cabinet today will start to ease some of those pressures, even interstate.
Thank you for that. Can I also ask you about paediatric doses? We heard evidence today at a select committee from SA Health that there was about 70,000 doses that were being administered by SA Health clinics, and then there was some data that was put out by the federal authorities suggesting that we'd be nearly close to the eligible ages 5 to 11-year-olds. Do we have enough doses here in South Australia, and do you anticipate that how many children do you anticipate being vaccinated by the time that school may or may not return on January 31?
So South Australia Health does around about 50% of all the vaccinations in South Australia. We have 144,000 5 to 11-year-olds. Not all of them are going to want to have that vaccination, but we certainly have our 50% ready to go with the first dose, and the private sector, so the primary healthcare sector, so we're talking about GPs and pharmacies, will be getting their distribution separately. So we've got no problems whatsoever with the first dose, and of course there are new doses coming in all the time. So there will be no problems. The issue at the moment is just workforce to get those jabs into the arms. But as you can see, we're ramping up those opportunities all the time. We're looking at all and every opportunity to get those into the arms of young South Australians. So I think it's moving in the right direction at the moment.
Thank you for that. And my final question is more of a personal question to yourself. You obviously are in isolation due to your daughter having COVID. Two questions, if I may. Firstly, how is she? And secondly, you referred to this morning on radio that your test was, your result returned probably slightly quicker than, say, other members of the general public. What was your turnaround, and why was that test result quicker than, say, the normal general public?
Well, first of all, on Georgie, she's doing really well. In fact, I'm speaking to her probably more often than I would normally speak to her because she's a little bit more bored, and so I think she's giving me a buzz on a more regular basis than she normally would, but she's doing extraordinarily well, making the best of the situation, getting a few jobs done that she needed to get done. So thank you for asking, Andrew. With regards to my PCR test, I called Associate Professor Dr. Tom Dodd on Saturday afternoon. I told him that I was a close contact and just sought his advice. He said that he would be happy to send somebody around to my house. I thought, no, they've got better things to do. And I'd already driven past the Victoria Park racecourse on Saturday afternoon, and the line was very negligible. So I went off to Victoria Park, had that test. He asked me to let him know when it went through so that he would look out for it when it came into the lab and process it in an expeditious way. Obviously, I'd been with you guys earlier that day. We don't want to infect the media, and Professor Nicholas Spurrier the day before. So it was really important that if it was a positive result, that we could inform people straight away, especially Professor Spurrier. I'm very grateful. It was a negative result, so it was put around in an extremely tight time frame. I think it probably went through in about 4 or 6 hours. I don't know exactly.
Thank you, and thank you for putting this on today. I'm sure everyone else agrees with that.
Thanks very much, guys.